JBS presents the Hampton Synagogue's Author Discussion Series with Rabbi Bronstein.
My name is Glenn Dorskin. Welcome to the Hampton Synagogue. The Hampton Synagogue Author Discussion Series is a cultural highlight of our summer season, both for members of our congregation and our many visitors from across the Hamptons. I am proud to serve as series chair, and it is my great pleasure to share our past season with you, our global congregation, in celebration of Jewish Book Month. Please welcome Stephen Fried back to the Hampton Synagogue.
Thank you. Glenn described in his introduction a whole range of topics that you've written to and written books about in the past. Why mental health? What's your connection to this particular topic?
Sure. I've been interested in mental health since I was very young. I grew up in Harrisburg. Everybody in the Jewish community in Harrisburg knows that one of the most prominent members of the community lost his son to suicide on Yom Kippur in 1973. Everybody in Harrisburg knows this. Everybody talked about it at dinner, and then nobody ever talked about it again, which is unfortunately what mental illness and addiction are like in this country. So that made me interested in mental illness from a very young age, and when I became a journalist, I wanted to see if I could write stories. I mean, I wasn't interested in writing policy pieces. I really wanted to see if I could tell real stories about what it was like to have these illnesses, when we lose people, what actually happens. And very early in my career, when I was 26, there were a series of teenage suicides in a small town outside of Philadelphia where I was working. And I basically went up there and it reported the deaths of these kids and the lives of the kids that survived for 6 months. And I was very fortunate that all the mental health professionals who had treated these kids were given clearance to talk to me. All the school officials talked to me. Everybody talked to me because everybody was so scared that 3 kids had died in such a short period of time. And I wrote this 18,000 word piece about what this experience, these kids had jumped off a cliff. Two of them had jumped off a cliff handcuffed together after taking 11 hits of acid each. And they had a boombox with them, and they recorded the last 2 hours of their incoherent conversations, which I got, and which we use in the story. So from a very early time in my journalistic career, I always was interested. You can't do it always. People don't have the highest tolerance for it. But I always tried to do stories that were about mental illness, about addiction. My first book about the model Gia that became the movie with Angelina Jolie. Obviously, Gia was a heroin addict, suffered with bipolar disorder, died of AIDS because of her heroin addiction. And so I've always done stories about this. Probably the best known, and the reason that I met Patrick is, have you guys all read An Unquiet Mind, the book by Kay Jamison, or do you know about it? It's sort of the most famous book about bipolar disorder, huge bestseller. Anyway, Kay Jamison is somebody who I had met and interviewed, and I did a profile of her, and during the course of the profile, she came out with her bipolar disorder because she had never told anybody that she had it before. And she felt that I would be a good writer to tell it to. So I've had these experiences, and I've always learned the power of being able to tell really in-depth stories about mental illness that are not judgy or preachy, but are just what the real world is like for people who have addictions, the real world is like for people who have mental illnesses, for their families, and all the things that go wrong and right. They're very messy illnesses, and there's a lot of judgment about them. And so I met Patrick.
Right. So
Patrick,
my next question was going to be, how did you meet Patrick?
So Patrick's younger than me. Patrick's a kid. Patrick is the youngest child of Ted Kennedy. And Patrick had a pretty well-known history with drugs and mental illness himself. He had been in rehab for cocaine when he was in high school, and one of the people in rehab with him sold his story to the National Enquirer. So Patrick was first outed as having a substance use disorder in the National Enquirer by a guy who had been in rehab with him. And as he grew up and started being in politics, he didn't set out to do this, but he was struggling with bipolar disorder himself and with alcoholism, later opiate addiction, and he didn't do a very good job struggling with it. So he was very famously drove his car into a stanchion outside of the House of Representatives at 3 o'clock in the morning when he thought he was coming to give a vote. And then incredibly bravely, instead of listening to his father who told him to just go out and say, it's a little fender bender, it's no big deal, he announced on national television that he was going to rehab, that he had a substance use disorder and he was going to go get treated, and he was going to be very public about that. I thought that was very brave. He didn't pretend that he got all better. He struggled with substance use disorder for the next 10 years, and it's part of the reason that he left Congress in 2010. I had never met him before. Right after he left Congress, we were introduced by somebody I had interviewed for another story who knew him and who was involved in an advocacy movement. When he left Congress, he wanted to do something incredibly important in advocacy to try to bring together all the different brain diseases so they could work together. One of the challenges in our country is that we have people who care about mental illness, we have people who care about substance use disorders, there's splits between the different substances. Alcohol people are in one place, opiate people are in another place. There are people with epilepsy and other brain diseases. There are people who have developmental disabilities. In theory, all these people and their families should be able to row in the same direction to try to get better coverage, to try to get people to stop being so mean and judgmental towards them. But instead, they kind of have their own things. So Patrick's feeling was that he wanted to try to do something to bring the different people who had the same kinds of issues that have to do with the brain and the stigma of brain illness together. So we were introduced, and I hung out with him, and we talked about doing something, and then we didn't. And then a magazine editor heard that I had been hanging out with him and said, do you want to do a profile of him? And I went to him and I said, if I did this profile, everything I've heard from you during the time we've been hanging out, which was not a journalistic time, would have to be on the record. And he was like, who cares? Just, I know you'll do a good job, I trust you. And his wife was the same way, and he had just gotten engaged. And he was, I didn't realize at the time, but when I met him, he was 3 weeks sober.
Wow.
And he was with this woman, Amy, and they were going to build this life together, and she was going to help him stay sober. He's 13 years sober today. And we decided that that I would write a book with him, for him, that would use his story to also tell the story of mental illness in America. So there's lots of books about all the history of the Community Mental Health Act and all the kind of stuff. Our goal was to try to weave that material into a Kennedy story, because the Kennedys were involved in many of these things.
And people would read it.
And people would read it. And so it would be sort of a half Kennedy memoir and half a story of mental health in America. And it would bring together the things that he cared about, the things that I had been reporting on for a long time. And so we wrote this book called A Common Struggle. And it was on 60 Minutes the first day it was out, and it was on the bestseller list, and half of Patrick's family denied that it was true. His brother and he have had difficulty since it came out. It's not easy in your family, it's not easy when you have an illness to not be able to tell your family. Then when you tell your family and you want to be open, not everybody's on board. People are embarrassed, people are judgmental. It's hard. I mean, people aren't like that about other diseases.
In what ways is this book kind of a follow-up or a sequel to that book? Or in what ways it's standalone? I
mean, the first book was, we wanted to show people how in-depth you could go. I mean, Patrick learned more about his own medical history because I investigated it than he ever would have. I mean, we went and interviewed his therapists. His first therapist is Peter Kramer, the guy who wrote Listening to Prozac. Interesting. So you can imagine, here's Patrick coming back to Providence, back to his shrink's office with a journalist and a tape recorder. And we're going to interview his therapist, and we want to know if he'll show us his notes from when Patrick is being treated. And it's Peter Kramer, and Peter Kramer is an interesting guy. But but it was like that. He was a Kennedy. He got all the best treatment. One of the things that's important to see in the book is you can get the best treatment from every person who matters in these fields. These illnesses are still incredibly hard to treat. There is still people still. If they have addictions, they still relapse. If they have mental illness, even when they are treating it exactly the way they're supposed to, symptoms can break through. People don't want to hear that. I mean, a lot of what we know about these illnesses is once you get sober, you're sober. And once you get diagnosed and get the right medication, it's like you don't have the illness. If you have depression or bipolar disorder or schizophrenia. That's a very popular point of view that comes from drug company ads and from celebrities who come out a little bit, because people only come out when they're feeling really good, you know. And so our goal was to like, well, what if you wrote about people not only when they were feeling really good, but at all the different phases of their lives?
And this is one of the things that happens when you refer to mental illness with the word illness, right? Usually when you think of an illness, that's something that you can treat and then you recover from it, and then either you don't have it anymore, or it's the kind of thing where you have it, but you don't really, it doesn't show anymore. You can function just as you normally would be able to.
Well, see what you just did, you started with the original idea, which is you have it and then you get rid of it. But then we all know that isn't really true. So our idea is that's how mental illnesses are different than other illnesses, but I would suggest that all illnesses, we tell the story when we feel really good. Heart disease, cancer, IBS, whatever it is. Most illnesses are more chronic than people want to let on because they only talk about them when they're feeling better. And we as a society aren't really good at hearing, oh, you're sick again. I thought that was done. Right. People want it to be done. So there's a lot of this, and something that Patrick and I always talked about. And so while Patrick is a super policy wonk, and thank God, because there are many times when laws get passed only because Patrick has devoted all his energy and convened all the people that a Kennedy can convene to get these things passed. And they're very esoteric. There's a law actually coming out very soon, another interpretation of the Mental Health Parity Act, which Patrick and his father got passed, which is the law that makes it illegal for insurance companies to not cover mental illness and addiction at the same level that they cover all other illnesses. That's the law. It doesn't mean it always happens, but that's the law. So we had always talked about if we ever did another book, it would be about regular people. And the idea would be for have them to talk about what it's really like longitudinally to have these illnesses, and what it would be like if you interviewed not only them. There's a phrase. Do you know the phrase "lived experience"? Is that a phrase that means something to most people? So it's a phrase in a lot of different illnesses. Certainly a phrase in mental illness and addiction. And it's important because it's people saying like, "This is my experience. I want to be able to share it with somebody." But a lot of times when people share the lived experience, it only means something to them. People aren't always that great at explaining what it's like to have the illnesses. So, we thought like reported lived experience, where I would go out and I would interview other people. We would get their permission. We would ask people to get their medical records. We would ask them if we could have permission to talk to their doctors, even the doctors they were mad at. One time we wanted to interview somebody's mom, and he said, "Well, I don't speak to her, but you can." But you know what? A year later, he was living with her because he had gotten sick again, and he needed to move in back home. So the other part of it is to spend enough time with people to show how the illnesses change, rather than just sort of a snapshot of it. So we always thought this would be an interesting thing to do. We never did it. And it's interesting that we're in the Olympics because we actually finally decided to do it during the last Olympics. Simone Biles was on TV looking incredibly uncomfortable, trying to explain to the country that she had a mental illness, but she didn't really want to talk about it, but she wasn't going to compete. And Patrick and I were kind of watching her writhe on national television and watching the way people were reacting to her. They were really mean about it. She didn't know really how to talk about it. And I texted him and I just said, "This is so bad." And it's such a typical example of how little we can talk about these illnesses. You want to know why it's so hard to pass laws and get all this stuff in place? It's because people don't basically understand what it is like to have these illnesses. I said, what if we actually did a book that was just profiles in courage? I mean, I jokingly said profiles in courage. I wasn't sure we'd be allowed to use the phrase.
It's trademark, I'm
but
sure.
Profiles in courage of people with mental illness and addiction, where we would find people who would tell their stories for the first time, not advocates, not people who were telling you this means we should do this, just telling their stories the way they would never tell them to their families, but they wish they could, would never tell to their bosses, but wish they could, because they wish they could be that understood.
So I think that's part of what my next question was going to be about. What makes this book interesting for me especially is that at the end there isn't a chapter with policy recommendations, or here are the takeaways you're supposed to take away from these stories, or this is what this all should mean to you as the reader who's reading these stories. The stories just all kind of stand by themselves.
I hope they do. I mean, I think that if you read them, you probably see what the problems are. And what's interesting about the problems is that while we're always looking for new solutions, new treatments, new tests, We don't actually use the treatments and the tests that we have all that much. I mean, the percentage of people who get evidence-based care for these illnesses is astonishingly low. The percentage of people who get evidence-based care for addiction in the last survey, what do you think it was?
Probably less than 10%.
Wait, no, it was 12%. I mean, 12%. So that means we don't even know what the world would be like if people who had opiate addiction, alcohol addiction, other addictions just got the evidence-based treatment that we know works. And in mental illness, the numbers are they're in the mid 50s and 60s. So there's low rates of diagnosis, there's low rates of accurate diagnosis. People don't want to be on medication, they don't want to go to talk therapy, they want to feel better. So they resist. And they move from doctor to doctor, or they hide. I mean, one of the most amazing stories in this book that I thought was amazing is, the actress Gabrielle Anwar, who most of us know because she was the one who danced with Al Pacino in Scent of a Woman. She told this amazing story of sort of being in Hollywood, being a bipolar person in Hollywood, and being with a lot of other people who had mental illness who were struggling with it. And she actually got properly diagnosed. And she was given 2 medications, one to be a mood stabilizer, the other to deal with the sedation that comes from the mood stabilizing. And she said, I filled the prescriptions, I filled both of them for 20 years, and only took the thing that's supposed to make me higher. So she just took the Adderall, which she was supposed to be taking to deal with the sedation, which made her high and manic constantly all the time. And she actually tells this amazing story. She was in all these different movies. She moved to Miami. She was in that TV show Burn Notice. And she started dating this guy, Sharif Malnik, who is a big Jewish restaurateur there. And they were out on a date, and he thought it was going well, and they were drinking, and he said to her, maybe you shouldn't have another drink. And she punched him in the mouth. And he realized, like, wow, there's something going on here besides just the normal level of an actress, whatever. And he actually jokingly said, why don't you just do it again? And she did again. And so they told this amazing story to Patrick and I about what they did as a couple to try to get to the point where she was getting treatment, because they were in love. They wanted to get married, and he was asking himself, can I marry somebody before she gets better? And the process they went through for him to understand that she's never gonna be better. She's always gonna have this illness. We are always gonna struggle with it. We're always gonna struggle with the treatment of it. But if you love somebody, you need to understand that and be with them even though it's challenging. So a lot of the book is not only about the individual people with the illnesses, but the people in their lives who either help them or hurt them. One of the characters who's been hospitalized, a woman who's a healthcare worker in Nashville, and she has very severe schizoaffective disorder and opiate addiction, and she's been hospitalized like 50 times. She's also amazingly resilient because she has lived through incredible numbers of overdoses. And I think most of us don't understand how we hear about overdoses, we hear about the people dying from them. What you don't know is for people who take drugs, a lot of them overdose a lot of times and don't die. It's actually, so she told us the story about her father came to visit her in the hospital, literally after like one of her 50 plus hospitalizations. And she's in her 40s and he's in the 70s. And he turned to her and he said, I'm starting to think that what's going on with you is some kind of disease. And she was like, yeah, I've only been telling you that for like 30 years. So it is really challenging for people to be able to share these things with their family members as they are understanding them themselves. The diseases are of your brain, so sometimes your brain isn't exactly working the way you would like it to. It's very challenging. And so our goal was, we already wrote a book which is really about the policy, about the history of the policy and all that kind of stuff. This one, we just wanted 12 amazing stories where people would go, wow, no matter what the diagnosis is, the challenges in the family, the challenges in getting treatment, the challenges in paying for the treatment, the challenges if you can't work, how you deal with life, are kind of very similar. And there is a QR code in the back because Patrick can't live
without a QR code.
Without a QR code to all the solutions. But what's amazing about the solutions and this new program that he has called Alignment for Progress is it's a compendium of things that people already thought of, many of which have been put into place and then unfunded. The terrible thing about mental illness is for all the things that we still don't know, there's a lot of things we actually know work and people can't continue funding them. Different administrations come in and defund them. People, they don't want, so the politics of this are very confusing. And you know what? The people who have the illnesses can't wait for the politics. So one of the messages of this book is we're all for the politics. Patrick's out there with the politics every day. But we have to take care of the people who have the illnesses until the politics come. The conversation, if you're in pain, can't be, well, we're trying to get this bill passed. The conversation has to be like, what doctor do you need? What medication do you need? Do you need inpatient care? If you need it, how are we going to get you there? If you need your community to be more supportive, what are we going to do about that? And when you read these stories, you can't not think, I know people like this that I didn't really understand, and maybe I understand them better. I mean, did you ever have an experience where you never experienced something before and then all of a sudden you realize, wow, I just never got this? Like, I had friends who lost their parents when they were young, and I had no concept of that because I had both of my parents. And then my dad died when I was 38. And I suddenly thought, God, I am so stupid. All the people I knew who lost their parents before, I had no idea what they were going through. I had no idea what they needed from me and from society. And I think that when you read these stories, you get that feeling about mental illness and addiction, about suicidality, about drug overdoses, that the people in our lives need more from us, more understanding, more knowledge, more sympathy, and more being able to deal with the uncertainty, because these illnesses are incredibly messy.
So a two-part question that kind of builds on...
And then I'll give you a seven-part answer.
That kind of builds on that, right. That seems to be what we're doing, which is great. Besides just it being a cute Kennedy tie-in, what do you mean by courage in the title? That's point one.
Okay.
And point two is going to be just in general. How did you find the stories that you wanted to tell in this book? What were you looking for exactly to highlight?
So, when we talked about profiles in courage, like profiles in courage is something that, obviously JFK wrote this book in the 1950s.
Right, and they were meant to be exceptional people.
Well, no, his goal was during the era right after McCarthy, to write about people who had, in the Senate, and he was a senator, in the Senate, who had done things that were exceptional and against even their own politics because they were the right things to do. That was the kind of courage that he thought needed to be instigated or re-examined in America. And he looked at people from John Quincy Adams up through people during his own time period. Patrick and I talked about one of the challenges of this is that people don't think of people with mental illnesses as fighting a courageous fight. They think of them, unfortunately, too often as being sad, pathetic, and they're judgmental of them. And so part of the reason that we thought it would be cool to use this title is because if we can recast what these people are going through as courageous, whether they succeed or not, and the people who lose their lives to suicide, I think that the families have to understand that the people were fighting a courageous fight up until the end. So if we could get people to think of that as courageous, that would be a powerful thing.
It's clear that the experience of telling you and Patrick their stories had a tremendous impact on the people that you interviewed.
I think so.
And the stories are in here. I'm wondering about the impact on you. Did you walk away with something that you really didn't expect to hear, or do you feel as though some of your perspective changed in a profound way over the course of writing this book?
All of those things. I mean, there are some things that I expected to hear. There are other things that I couldn't believe that I was hearing. One, I couldn't believe people were telling me. Well, okay, so there's one character in the book, Tony Dreher, Miss Tony. She was from the South. She came to New York City. She was a drug addict. She was selling sex to get drugs. She lived on the street. She lived on a bench in Harlem. She actually showed us the bench. I don't know if you saw her. She was on CBS Saturday Morning, and she took Michelle Miller to the bench. Tony was sick for so long and high for so long. At first she started telling us that she had kids when she was high and they were born on drugs and they took them away from her. That's not so uncommon. Then she told us that she didn't know how many times that had happened.
Wow.
Because she was sick and in and out of the hospital and in and out of jail for so long. And that now that she was better, now that she was under treatment, and the only reason she got treatment, this is incredible, she went to a therapist who she was supposed to talk to for 5 minutes so she could get her Social Security form signed so she could get benefits. He became her therapist and he convinced her that her drug use and her hallucinations were mental illness. That she was, and it never occurred to her that she had a mental health problem. She'd always been talked to in the language of recovery. You need to stop taking drugs. One of the things about this book that we feel very strongly about, we do not draw lines between mental illness and addiction. We do not draw lines between suicide and overdose. These things are all part of the same thing. And I don't mean that they don't have specific treatments that are different from each other, but we are really invested in a society and not seeing them all together. And because of that, we don't offer people what's called wraparound care, where we're thinking of all the different things that can be dangerous for them. And we want our addiction problems to be about addiction. If you tell somebody who's in AA they have a mental illness, some of them will agree with you and some of them will do anything to stop you from doing that. There are people who are really invested in suicide prevention and saying, my kid wasn't mentally ill. He or she just killed themselves. That is a debate that can be a little scary, and it really is difficult, because in reality the biggest thing that we can do to prevent suicide is for people who have mental illness to be treated, and for people who are saying they are feeling suicidal to be taken seriously, and to be given treatment and not to be just waited out. But we're not particularly good at all those things. So, but Tony talked about the fact that she had she had a lot of kids, some of whom she knew, some of whom she didn't know yet. She said that her kids that she knew had actually started a private Facebook group because they were trying to find the other kids. And Tony was trying to go through the courts and seeing if the agencies that had taken her kids away would help her at least identify them, because she wanted to make sure, and I thought this is really cool, that they got mental health care. That if she had them when she was sick, they needed mental health care. She said, especially black people do not understand that people need mental health care. I am here to talk to them to make sure they understand that, because we can't only live in the language of addiction and the language of jail. We have to live in the language of mental health.
So, big picture, even as each of these stories is so individual and really stands by itself, are there any larger through lines that connect them, or any larger themes that you're trying to bring to the reader?
Absolutely. Prejudice, stigma, self-stigma, impatience, impatience with yourself, impatience with the medical community, anger at the limitations of knowledge, instead of just admitting that we know as much as we know. Failures of families and communities to be there at the right time, and to, if they aren't, to apologize or to say we would like to do better. This is everybody. It's not just them. It's not just the other. If you open your eyes and see, it's a higher percentage of everybody than you could ever believe.
Parity of knowledge and parity of compassion.
Yes.
I think those are the buzzwords. I think that's a great way to end. So,
Great.
Stephen, thank you so much.
Thank you.